come next time, but not just introduce the subject. Be quick, please.
Thank you very much. Good evening, my name is Kane, Titchener, and I'm a member of the Waihi Beach Community Board. I've been voluntarily working to stop fluoridation in New Zealand for the past 10 years. Firstly, as you will be aware from the recent discussions at the Western Bay Community Council meeting, that the fluoridation of the district is maybe very close. The Director General of Health now has the decision-making power over fluoridation, and they are determined to fluoridate every town over a population of 500 in New Zealand. Many people do not realise that the Ministry of Health's policy is to promote fluoridation. The Ministry of Health is not unbiased. Currently there is no requirement for public consultation, but there should absolutely be public consultation. We don't live in North Korea, well not yet anyway. Secondly, and this may be news to you, on Monday the 12th of June, legal review proceedings were filed by New Health New Zealand against the Director General of Health's directives to 14 local councils to fluoridate parts of their water supplies. Western Bay Council can join this legal review and attempt to force an injunction on fluoridation starting. I have the details with me, and if you're interested. So what are the health concerns? One of the many is related to the emerging human research on fluoride and IQ. The National Toxicology Program, or NTP, is in the final stages of publishing a 6-year review of fluoride's neurotoxicity. The NTP is an inter-agency collaboration within the US Department of Health and Human Services. It is a partnership of the National Institute for Occupational Safety and Health, part of the CBEC, the Food and Drug Administration, and the National Institute for Environmental Health Sciences, part of the NIH, the National Institutes of Health. The NTP focuses on testing, research and analysis of agents to identify toxic and biological effects. It provides information that it strengthens the science base. It informs decisions by health, regulatory and research agencies to safeguard public health. This is the top US government collaboration on health and science. The review was issued in 2 parts, a monograph and a meta-analysis. The report concluded that prenatal and early life exposures can reduce IQ. The meta-analysis reported that 52 of 55 studies, a 95% consistency, found lower IQ with high and low fluoride exposures. The result of those studies was a 7 IQ point reduction. Of the 19 studies rated high quality, 18 found a lowering of IQ. High quality studies are based on creation, data and design of the research. They also denote a lack of bias as a result. The meta-analysis could not detect a safe level of exposure. No safe threshold of fluoride in water. The NTP recognised that of the highest quality studies, the Canadian and Mexican cohort data were the strongest. Those studies found an IQ reduction in the range of between 3 to 9 IQ points. On average, a 1 part per million increase may cause a 5 IQ point reduction. Because we fluoridate between 0.7 and 1 part per million in New Zealand, the loss of IQ is on average between 3 to 5 IQ points across the population for those exposed. This is why we now say fluoride is the new lead. As you will be aware, lead lowered IQ by 4 IQ points and was removed from petrol and paint. As a replacement for fluoridation, Fluoride Free New Zealand suggests the Scotland Child Smile program be implemented. This is a program that non-fluoridated Scotland has been implementing for 20 years. The results speak for themselves. Scotland has managed to halve the number of general anaesthetic operations from tooth decay in that time that the Scotland Child Smile program has started. You'll see the details in the pamphlet that has been circulated to you. In terms of cost of implementation, fluoridation, Christchurch alone is going to cost $63 million. Here is your funding for Kiwi Child Smile. Given the NTP report, I'm asking that the Waihi Beach Community Board request via motion that the Western Bay PT Council investigate the NTP fluoride report and hold public consultation so the community can be heard. I'm also requesting that the board add their support to my move for Region 2 of CBEC to request that fluoridation be reviewed in the light of the NTP report.
Can I stop you there?
Can I say one last sentence?
One last thing there.
The jury is now in on fluoride, and the fluoridation rollout needs to stop immediately.
Thank you.
Woohoo! Yes! Woohoo!
You are aware that there was, and you can talk about it.
Where was it?
At council on Wednesday, last Wednesday.
Yes, it came before council, and we had a round discussion about it, and it was voted 10 to 2, 10 votes against 2, that we would approach the, health department and ask them to come and speak to us and talk to us about the fluoridation in the water and what that, we'll be able to question them. Just really, stalling at the moment, and we haven't,
Yeah, ask for a reduction now.
so we haven't looked at it any further than that, but I don't know whether I'm assuming that the staff have generated that, I don't know whether that's happened yet or what. It's just recent, so we'll be following that
Can we
up.
get the injunction?
We haven't gone any further, that was something that we'll have to be able to discuss.
Come on, community board, fine.
You can give us a full presentation next time.
I've just given an hour and a half.
So, will it,
You won't get an hour and a
Yeah,
half.
but
you
you-
get
I've
10
just given
minutes.
an hour and a half of presentation from Raglan. So I'm here now to answer questions.
yeah, well, it'll be another 6 weeks before we have a meeting here, but it's really, we need to go to council, that's where the decision will be made about what we're going to do. But just to let everyone know, in case you don't know, that this is mandated to us, $200,000 fine and 10,000 every day that we do not comply if we get down.
Exploring our children.
What is mandated? Council actually, Whānau, what is mandated?
Can we hear from the council, please?
Yeah, quiet.
Quiet.
Yeah.
Come on,
Look, we've
Ian,
heard,
carry on.
No, that's what I wanted to
I
say.
heard from the man
We've got our hand
saying
up.
what
Up the
he
back.
has presented to us. I've heard from the councillor of what happened last Wednesday. The council, it will come up for more debate,
Yeah, and we'll come around again.
and I
What we
hope
can
you
do,
come.
you're
I know
okay.
it's a long way for you to come, but we need to hear from you in result in 6 weeks, 2 months' time, when we have another community board, things may well have moved on a lot. Okay, thank you. Now I want to close the public session. Sorry, there's not going to be a lot of extras. We've already 25 minutes past our usual time.
Sorry,
Chairman,
yep. Oh, go on.
You're on.
Oh, okay. Yeah, regarding the last community board meeting where the mountain bike proposal was